You're watching Sound Health on Lagos Television. I am Olasumbo Mudukwe. Over 350 cases of Lassa fever have been reported in Nigeria and 3 deaths in the UK. Today on the program, we are taking a look at how to stop the further spread of the outbreak in the two countries. The conversation begins after COVID-19 updates. Please stay tuned.
The WHO will release its new operational guide strengthening COVID-19 vaccine demand and uptake in refugees and migrants. This, the agency says, is to support all those responsible for planning and implementing the rollout of COVID-19 vaccine to refugees and migrants at national and local levels. The guide is designed to provide practical support, strategies and good practices for understanding and addressing personal, social and practical barriers to COVID-19 vaccine among refugees and migrant populations, acknowledging that they may face a range of unique barriers to accessing immunization systems that need to be better considered by policymakers and planners. It also provides an overview of key activities and considerations for increasing confidence and uptake of COVID-19 vaccines in refugee and migrant populations. In South Africa, 14,440 tests were conducted in the last 24 hours, with 671 new cases, which represents a 4.6% positivity rate. No new deaths has been reported today, keeping the total fatalities 99,725 to date. Nigeria, on the other hand, reported 12 new confirmed COVID cases. Kaduna State had 5 cases, 3 in Delta and Rivers, while Oyo recorded 1 case. Over 255,001 cases have been confirmed. More than 249,373 discharged, and 3,142 deaths have been reported in the country.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Tobin Ekaete, a consultant public health physician with the Institute of Lassa Fever Research and Control in IRRUA Specialist Teaching Hospital in EDO STATE. She has been at the front line of the fight against infectious diseases including Lassa fever, Ebola, and monkeypox. Good evening, Dr. Tobin.
Thank you very much, Mufid.
Okay.
Good afternoon, viewers. Thanks for having me here.
It's a pleasure to always have you on the program. So, the Nigerian Center for Disease Control says more cases have been reported in about 21 states in the country. Why are we having a sudden outbreak again?
So, outbreaks of Lassa fever have been on for several years now. There's never a year we don't have an outbreak. The magnitude of the outbreak is what differs. So the surge in the number of cases is expected because this is about the time from December to March when we have cases. The only issue is that last year we didn't have as many cases as we're seeing now. So it's not expected. We actually always prepare for the yearly outbreak. And it could be for many reasons, many factors. The bush burning that is going on currently, the fact that we are cultivating more and more into the ecosystem of these rodents, we're going more and more into the bush to cultivate beyond where we live. These are all factors. And then the constant poor sanitary conditions of our environment. These are all drivers of the outbreak, the yearly outbreak, and it's expected at this time. So it's nothing really new.
Okay, before we go further into the discussion, what exactly is Lassa fever? What causes Lassa fever?
So Lassa fever is an acute hemorrhagic illness. It's a viral hemorrhagic fever caused by the Lassa virus. The Lassa virus is an belongs to the Viridae family of viruses. And it is carried by a reservoir host, a rodent called Mastomys natalensis. And the disease affects, upon entry into the body, the disease goes to affect almost all the organs, causing an acute illness that, untreated, for about 20% of persons, manifest in clinical illness for which they have to go to seek medical care in a health facility. So it's a viral hemorrhagic fever, and it's very common in the West African. It's been reported in Senegal, Guinea. It's been noted in Sierra Leone, Liberia. So it's a West African ill found in West Africa, mainly in the rural areas. And it was first isolated in 1969 when a missionary nurse, Lara White, got infected. And but over the years, we've seen it spread from 2-3 states to almost over 20 states in the country. And right from when Laura Wine was infected till now, we're still having healthcare workers coming down with Lassa. So that's in a nutshell what it is.
Okay, Dr. Tobin, it is worrisome that about 98 deaths have been reported in the country, while 3 deaths were also reported in the UK. Is this actually something one should be worried about? How did we get here? Because it appears that it is not only synonymous with Nigeria.
Yeah, it's sad that in 50 years since 1969 till 2020, over 50 years, we're still reporting deaths in the country. But you see, the attention, we usually tag Lassa fever as one of those neglected diseases, because the attention focus only came on Lassa fever in recent years, where global interest now, we've been talking, especially from my center here in IRRUA Special Institutions, going to gain national attention. But it's only in recent years that NCDC and WHO started prioritizing Lassa fever. So it has been there. It's not as if it was been causing deaths. In fact, we record previous epidemics as at 2011-12, we're recording mortalities of case fatality rates of over 60%. So we always want to make sure that we bring down case fatality to even one digit, make it like 1 digit, so that we don't, we shouldn't have people dying of Lassa fever at a time like this, over 50 years down the line since it was first discovered. But unfortunately, it is. But I want to quickly say here that we've improved on case finding, we've improved on laboratory diagnosis, we have improved on treatment and management. So if people come early, we won't be seeing, if people present early for treatment, laboratory diagnosis and treatment, we won't be having this case fatality, 98 deaths in a year. It won't be like that. We'll be having those numbers. I think it's something about when people are in denial of the disease, that the disease exists, when they present late, when they treat and feel that high index of suspicion is not there, they present late. And once they present late, almost really prognosis is usually poor.
Okay, in order to report early to the nearest medical center, now what are the symptoms we must look out for?
So when it starts, it's usually like any other tropical febrile illness. So you have high-grade fever, you have sore throat, cough, vomiting. The person doesn't feel too well. It's malaria. You have body pains, joint pains, muscle pains, abdominal pains. And then at this time, you see people treating for malaria, but they don't get better. The malaria doctors suspected, they don't get better malaria treatment. And then untreated, you now start having, the person now enters the second phase where you have organ manifestation. You start having renal disease, you start having central nervous system affectation where the person becomes disoriented, psychosis, has gait movement abnormalities. And in many cases, they progress to coma and death. Convulsions set in, and if they are pregnant, they have abortions. So if they can pick it, once we have a high index of suspicion, and the person comes, has been treated for fever, unresponsive, symptoms, then we should start thinking of Lassa.
Okay,
So
Doctor.
it usually manifests like any other febrile illness, but then progresses. And at the still end, the person starts bleeding. That's where you have the hemorrhagic component of the viral hemorrhagic fever. The person starts bleeding from orifices, even from injection sites. Just bleeds.
Okay, how can we prevent the spread of Lassa fever? Because obviously you said we are experiencing the prevalence as a result of bush burning and other lifestyle that are not encouraging. How do we prevent the spread?
Okay, so to talk about spread, we have to first of all know how it is. To talk about prevention, we have to know how it spread. Now, you can have the primary transmission, which is from the rodent to man. That is generally the transmission that we know, and the primary mode of transmission from the rodent to man. But then secondary, from man to man, and that is where you see the health facilities in close contact to infected persons. So primarily, when a person gets in contact with the urine or feces of these rodents, either by mistakenly eating them in food or contaminating eating utensils, pots and pans that are not properly stored, or even contaminating surfaces, tabletops and fomites, door handles, where the rodent urinates on and it dries, and then we have indirect contact with these surfaces. The tendency, the high probability the person get infected with the plant. Even when preparing rodents, in the process of preparing, and then you're exposed to blood and you have pots, that is another mode of transmission. And then from human to human, we see that in health facilities and among close contacts, where in health facilities, when there is lack of attention to IPC, infection prevention and control, from contaminated equipment to accidental needle injuries, to handling soiled linen, beddings and clothing of infected persons with bare hands. These are all modes of transmission. And then if we have to stop it, then we have to break all these chains, address all these modes of transmission. So preventing contact with the rodent, we talk about food storage practice. So we store our food in covered containers so that the rodents, urine and feces don't have access to that, including our eating utensils, our plates and our pots. We make sure that our homes are clean. The rats can only come in to dirty houses, and then houses where you have cracks in the wall, you have cracks in the roof. So safe, good housing, proper housing reduces the contact, human rodent contact. And then of course, making sure that we have performed good hand hygiene, even in the home. So we wash our hands before we eat, wash our hands when we contact dirt, anything dirty. Keeping that personal hygiene is another way we can reduce transmission. And bush burning. Bush burning, the fire in the bush drives the rodents out from the bush into our homes. So reducing bush burning is another way we can stop the rodent-human contacts, break that mode of transmission. And then in the health facility for secondary transmission, making sure that our healthcare workers adhere to IPC. So using our hand gloves, carrying out hand hygiene, barrier nursing, making sure that we make sure that we, as much as possible, protect ourselves when we come in contact with these persons, where they are appropriate. Make sure these persons are isolated, reduce the visits. So access control and other measures of IPC will reduce healthcare worker infections. And of course, close contacts as well in the secondary mode of transmission.
Okay, Dr. Tobin, apart from treating every case like a suspected one now, is there actually a cure for Lassa fever? Can it be treated?
Yeah, we do have drug treatment for Lassa fever, although primarily treatment is supportive in the sense that we make sure that the infected person electrolytes and fluids are maintained, have a proper balance. We make sure that the person has good nutrition. If the kidney functions are deranged, you have access to dialysis, ventilation, make sure that you correct any anemia. But then we also have ribavirin, a drug that we use and has over the years proven very effective. Once you get the infected person and present on time for treatment, ribavirin is a drug that we currently use in our environment.
All right, the continuous increase in cases is a stark reminder that we need to invest in disease preparedness and prevention. How do you think that we can improve on these aspects and change the narrative in the country?
So we have to raise the index of suspicion amongst health workers, raise the index of suspicion among health workers, attend to environmental cleanliness. Environmental sanitation must be our priority. Clean environments repel, discourage breeding of the rodents. So clean environments. Housing, we must address housing. Make sure our houses are rodent proof in the sense that cracks in the wall, cracks under the door are repaired. Make sure that people practice good food hygiene, sanitary practices. Their food hygiene practices are optimal. And then I must say here that in some cultures, corpses of persons who die are washed before they are buried. Now, if the person was a Lassa fever patient, died, and the corpse is still very infected, so discouraging practices like that, where the people handling the body, the corpse, in contact with fluid from the dead person, the corpse, should be discouraged, as that increases the risk, increases exposure to the virus. And of course, other cultural practices like drying our foods by the road, on top of the hard roads, should be discouraged because the rodents live around us. They are very many in our environment. So they run over this dried food, and their urine remains on it and then poses another source of infection to us. So all those practices should be discouraged. And making sure that we store food, whether it's food we're selling in the restaurants, food prepared in our homes, we store them in rodent-proof containers. If we're eating, we want to move away for a short period of time, we should cover them. If they're raw foods, we should cover them, keep them in cupboards, or keep them in covered containers. So we break that, we prevent our food from getting in contact with the rodent. If we do all this, then we can be very certain that these yearly outbreaks, the number of persons that come down with Lassa fever will reduce. And then, of course, I must say here quickly too, ensuring that infection prevention and control in our health facilities are top notch. So making sure that we have the right PPE, healthcare workers are trained on how to use the PPE appropriately. That is also utmost priority in reducing the scourge of Lassa fever.
Dr. Tobin Ekaete, consultant public health physician with Institute of Lassa Fever Research and Control in IRRUA Specialist Teaching Hospital, EDO STATE. Thank you so much for your time and expertise on how to curb the further spread of Lassa fever in the country.
Thank you very much, too.
It is still Sound Health on Lagos Television. We now take a look at trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Remember, if it feels like Lassa fever, it is definitely Lassa fever. Protect yourself and your loved ones and report symptoms early enough to the nearest health center around you. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at TLTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.